The Yendi municipality, which is in the northern region of Ghana, witnessed a life-changing moment when Direct Aid Ghana, in collaboration with AlBasar International Foundation, organizes free eye care treatment, especially cataract and other eye care related sicknesses, to the people of Yendi and adjoining communities. The people of Yendi are largely low-income earners. As such, affording basic treatment becomes a nightmare, while many faces challenges of losing their eye due to cataract infection and many other eye-related illnesses. Due to these reasons, Direct Aid Society, in collaboration with AlBasar International Foundation, organizes the free eye care treatment to the dwellers of Yendi and adjoining communities. The breakdown of activities as follows. Total number of people screened, 1,752. Total number of people who had surgery, 310. Total number of people who had eyeglasses, 450. Total number of people who received eye drops, antibiotics and other medication, 1,250. The rest of medicine and other smaller items were given to the Yendi government hospital. Suleiman Adam is the Human Resource Manager, Direct Aid Ghana, has explained the rationale behind this project.
The aim of this project is not only to assist our brothers who cannot see, but also to give happiness or to bring joy. Since we started on Monday till today, Thursday, we have been able to screen over 1,500 people, and then the number of surgeries that we have been able to do is amounting to 300 cataract patients. But we did some other minor surgeries, such as phaco and 3-jump. And then we are expecting by the end of tomorrow to be able to do not less than 500 cataract patient surgery. And then other minor surgery also.
Halid Al-Hassan, a pharmac nurse at Yendi Government Hospital, has this to say.
Cataract is one of the causes of reversible blindness. It means that cataract can be treated, it can be cured. And so there's a need for us to patronize the services. People have been going around saying that if you do the surgery, you will definitely become blind. It's not like that. It depends on the screening. If we do the screening and there's a problem at the back of the eye, we'll let you know the visual outcome. And so it's not true that if you undergo cataract surgery, you will definitely become blind. It's not like that. It depends on the assessment, the problem you have. If it's just cataracts, we operate, you should be able to see better than before. And then if it comes with other conditions, we screen, will let you know what the other conditions are, and then the possible visual outcomes after the surgery. We have a lot of cataract cases in Yendi and its surrounding communities. There are a lot of cases of cataract in Yendi and its surroundings. AlBasar International Foundation, in collaboration with Direct Aid, they have been very beneficial to the people. Cataract extraction is expensive, and so their coming has gone a long way to help our people have the cataract surgery for free.
Dr. Fayaz Ahmed Somoro is the head of medical team of AlBasar International Foundation, and he has explained to us their lineup of activities as far as the eye treatment is concerned.
We are here for the cataract patient. We started our screening to do screening for the patient who are having cataracts. So those who are having cataracts, we have admitted them, and those having needs of medicine, we have distributed the medicine. Those patients need glasses for the reading, and we have also distributed that one. Approximately now, currently, we have admitted more than 200 cases for the surgery, and OPD we have seen more than 1,500. And we have distributed medicine in those who have need of medicine and glasses.
He also mentioned that the collaboration between Direct Aid Ghana and AlBasar International Foundation has been very fruitful as far as this event is concerned.
With the collaboration with the Direct Aid, even last year we went Burkina Faso. We done with the help, and in their center we done also surgery there twice a year previously in Burkina Faso, Ouagadougou. We done approximately, I can tell you, the surgeries around 1,200 surgeries in a year, and other remaining surgery also we done also 300 surgery, as well as we done retina surgery also there in Ouagadougou in a teaching hospital. Before in 2004, I think we done last camp in Ghana. We have done 2-3 camps before. This is after a long time we came again in Ghana. So things are going well, and we are really appreciate the management of this Tamale. With direct aid, we are doing a lot of things.
Many beneficiaries who thought that all hope is lost, thanks to Direct Aid Ghana and AlBasar International Foundation, they can now breathe a sigh of hope. This is what some of them has to say.
Before operation, I was feeling very, very hot, and water be coming out my eyes like that. That's watering like that. As if it's shower. But when after yesterday, in fact, it has stopped. We thank them. In fact, when you go home, we will pray for them and it will reach them at their houses, and which we will be praying for our health.
By God's grace, I see clear. Because the first time I did this one, I had a problem. But this one, there, excellence. This one, excellence. To everybody, I pray it should be the same like mine. I thank Direct Aid. I thank Direct Aid for helping us in Yendi here. I thank them. God bless them. They have done something which I myself did not know it could be done. By God's grace, no. Everything is excellent and perfect.
I would like to use this chance to thank the Direct Aid and then AlBasar for their good work they have been doing here. Because this side of the country, a lot of people wouldn't afford to go through this surgery. But they are coming to do it free, hundreds of people, and we are grateful for the work that they are doing here. I myself, I'm having the same problem. I last came here, they were the people who helped me, and I'm still here. And I just want to say, God will bless them. They should continue with the good work. And we appreciate it, especially for the people of Yendi. I stand on behalf of the people of Yendi to say a very big thank you.
Ba mun gani komai zaka ci abinci ma wahala ne, an baka ruwa ma zaka sha wahala ne, ya hankuri zan da ku zo zaka fabe mun ga mun gode da Allah da Annabi saboda shi sabir da na ku yin mun ga mun gode.
The medical superintendent of Yendi Government Hospital, Dr. Ayuba Saidu Abdullahi, says the gap that exists in the Eyecare department of the hospital, hence welcoming Direct Aid and AlBasar Foundation to augment government effort, is highly welcome and highly appreciable.
Over the years in Ghana, there's a lot of unmet surgical needs in terms of cataracts, and we have limited ophthalmologists, ophthalmic surgeons in the country. Over here in Yendi and Eastern Corridor, what we do normally was that we do quarterly eye surgeries, and that's organized by one of the ophthalmologists in the northern region. It goes around, supported by World Vision NGO. Currently, there's a little of challenge that the help, the donation from World Vision is dwindling away, and as such, it's going to really affect the care for people with eye conditions. So the emergence of AlBasar and Direct Aid NGO in caring for people with cataract and other eye-related conditions is going to be a boost to all of us as Ghanaians. Over the last 4 days, they've screened almost about 1,000 patients. They've done almost about 320 surgeries, cataract surgeries, and identified glaucoma cases that they are giving free medications and what have you. We believe that if this bond is strengthened, in a long way, it will go to help the community and its environs. Most of the patients are not only from Yendi, they are from the adjoining districts who travel long distance to come and get this help. We hope to establish the link in a way that we will do it every quarterly to complement or supplement what is being done already in the local sector, so that at least 2 drops of water will make the bigger ocean and what have you. So it's a good opportunity for us and for the people of this sector of the country. Well, we have already expressed our gratitude and we are very happy, and we hope that we'll enhance the collaboration to ensure that this help does not end today, that it continues to even spread to the rest of the country and then the rest of the areas in Ghana. In Ghana here, this is the second place that they have done the surgery. I'm told they did one in Samam, which they did normal surgeries, and I think that if they are encouraged, they will be able to do more across the country, because the country is, quite a big landscape.
Hafiz TV, unique every day.